Hello and welcome to our podcast on the low percentage of Filipino American All of Us research program. In this episode, we will discuss why it is a concern, the current percentage of Filipino Americans in the program, some reasons for the low participation rate, and steps being taken to increase participation. We will also explore the potential benefits of increased participation, healthcare disparities among Filipino Americans, cultural beliefs that may affect participation, and strategies for addressing these beliefs. Finally, we will discuss some innovative strategies that can be implemented to increase the participation among Filipino Americans in the All of Us research program. Before we delve into our discussion, let me introduce myself. I am Mindy Ofiana, the president-elect of the Philippine Nurses Association of America Foundation. I am PNAAF's project lead for the Asian Health Coalition to support the All of Us research program. I'm a PNA Southern California chapter member and serve as its 21st president. Today, we are thrilled to have Dr. Kathy Abriam-Yago. Dr. Abriam-Yago has been a nurse leader and educator for 49 years and recently retired 2 years ago. Her clinical experience has been working in medical, surgical, intensive coronary care units, and home care. She's a professor emerita and past director of the Valley Foundation School of Nursing at San Jose State University. She is a member of the Philippine Nurses Association of America and the Philippine Nurses Association of Northern California chapter, and held several leadership roles in these associations. Dr. Yago, thank you for joining us today. So, Dr. Yago, can you tell us more about your work and how you became interested in health disparities among Asian American populations?
I became interested in health disparities among Asian American population when I was a student nurse, where I saw inequities to access of healthcare for patients of color. I have to tell you a story and why I went from working in the clinical setting and then being an educator, and how this incident made me more committed to issues of health disparities and decreasing that. When I was a nurse working in the ICU, I remember a nurse who was an experienced nurse asked me to come and help her with her patient because he was confused and needed to be tied down. I told her, sure, I would help her after I finished my assessment with my patients. So after I finished my assessment, I went to the nurse's patient's room. And right outside the door, I could hear this man speaking in Ilocano, a dialect in the Philippines, and he was yelling, "Nurse, nurse, help me. I'm in so much pain. Help me, help me." And I told the nurse that this patient is not confused. He needs pain medication. When did you give him the last pain medication? And she said, I gave it to him about 30 minutes ago. And I said, did you look at the blood pressure readings on the monitor? Did you check his respiratory rate? Did you look at his heart rate? Because she wasn't an experienced nurse. And it really bothered me that she missed so many signs and symptoms of what was going on. And she wanted to tie the patient down because he was confused, and he was not confused. So that night, it was my pivotal moment that I thought, yes, I am a nurse, but I need to teach others how to pick up certain cues, how to look at the assessment of patients. So I need to be a teacher. So that's what got me interested in the issues of health disparities. And again, with my experience with my Filipino American patient. And that's why I got into education and had this opportunity to teach student nurses how to make good assessments and provide correct intervention for patients.
That's a great story. So, why is the low percentage of Filipino Americans participants a concern?
Well, Filipino Americans are the third largest Asian American group in the US, but are underrepresented in medical research studies. This means that health data specific to this group may be unavailable, leading to potential health disparities and inadequate health care for this population.
That's definitely a concern. In that case, what is the current percentage of Filipino American participants in the All of Us research program?
According to a report by the Asian Journal, as of June 2019, Filipino Americans make up only 1.7% of all of us research program participants. Low participation.
Wow, that's really low percentage considering the size of Filipino American population in the United States. It's surprising to hear that rate. In any case, Dr. Abriam-Yago, what do you think there is such a low participation rate among Filipino Americans?
Well, I would like to share my experience in the work that Dr. Danette Bloom in patient-centered outcome research and Dr. Melinda Bender. What we found was the issue of mistrust of medical research. That was the number one and one of the most common statements that many of the participants said in this focus group. And the other issue is also the area of language barriers. That was to trying to understand what the healthcare provider was telling them and being able to get some of that explanation in their own language would be great. The other issue is the issue of cultural beliefs. That was another issue that had was another concern, and also the lack of awareness about the program. And those are some of the reasons I believe that people are not participating in this program.
I see. I see. So, what steps is the All of Us research program taking to increase participation among the Filipino Americans?
Currently, the program is working with community organizations such as the Filipino Nursing Association of America through its foundation, leaders, and the 53 chapters to raise awareness about the importance of participating in medical research and addressing concerns and barriers. They're currently working on Tagalog language materials to make information more accessible, and also partnering with other programs and healthcare providers to reach out to Filipino American patients and encouraging them to also participate.
It's great to hear the program is taking proactive steps to address barriers of Filipino Americans to participate in medical research. Our listeners who are Filipino descent would appreciate that effort. Thanks for sharing that. So, how can we increase participation among Filipino Americans benefit healthcare outcomes?
Well, I believe that increased participation can lead to more accurate and comprehensive health data specific to this population, which can help improve healthcare outcomes and reduce health disparities. It can also lead to the development of a personalized medicine that considers Filipino Americans' unique healthcare needs.
Hmm. That's a crucial point. Can you
Yes.
give us some examples of healthcare disparities that Filipino Americans face?
Yes. Filipino Americans have higher rates of hypertension, diabetes, and obesity than other Asian American groups. They also have a higher rate of liver cancer and are more likely to die from it than other racial and ethnic groups.
That's alarming. What steps can be taken to overcome these disparities and enhance healthcare outcomes for Filipino Americans?
Well, at this point, we can do several things to address these disparities. One is to increase representation in medical research studies, like All of Us research program. This can help us understand Filipino Americans' healthcare needs and develop a more personalized medicine that considers their unique healthcare needs. We can also work to improve access to healthcare services and address language barriers by providing materials in Tagalog and other Filipino languages. And had working with the opportunity with Dr. Bloom and Dr. Bender, this was definitely some of the suggestions that they told us that they wanted to be able to see and able to access care. So the other issue also is building trust with Filipino American patients. The healthcare providers really need to do that and to help them, educate them in the importance of medical research.
Those are really very important steps. Can you tell us more about the All of Us research program and how it can benefit Filipino Americans?
Sure. The All of Us research program is a research initiative by the National Institute of Health that aims to gather health data from at least 1 million people in the United States to improve healthcare outcomes and develop personalized medicine. Therefore, increased participation among Filipino Americans can lead to more accurate and comprehensive health data specific to this population, which can help improve healthcare outcomes and reduce health disparities. It also can lead to the development of personalized medicine that considers Filipino Americans' unique health needs.
You mentioned something about cultural beliefs. What cultural beliefs may affect participation in medical research among Filipino Americans?
Well, I believe that Filipino Americans have a strong sense of privacy and may be hesitant to share personal information, especially with institutions outside their community. Also, additionally, there may be also cultural beliefs that seeking medical attention is a sign of weakness, or that illness could be treated with other home remedies instead of medical intervention.
So, how can healthcare providers and community organizations address these cultural beliefs and encourage participation in medical research?
The biggest thing that I feel that needs to be done is that healthcare providers can work to build trust with their Filipino American patients and educate them about the importance of medical research. Also, community organizations can play a role in raising awareness about the program and addressing concerns and barriers. Also, providing Tagalog and other Filipino language materials can also make information more accessible and help overcome language barriers.
Hmm. Those are great suggestions. So, how can individuals support increased participation among Filipino Americans in this All of Us research program?
Well, nurses are advocates, so we can continue to do that, to advocate for our Filipino Americans. But also individuals can spread awareness about the program within their communities and encourage their friends and families to participate. They can also advocate for more diverse representation in medical research and the importance of medical research. They can also provide materials in Tagalog and other Filipino languages to make information more accessible and help overcome language barriers. Also, community organizations can play a role in raising awareness about the program and addressing concerns and barriers. They can also provide culturally sensitive materials addressing concerns and barriers. Also, they can provide materials and also help cater events to Filipino American communities' unique needs and interests.
That's really important. Are there any innovative strategies that can be implemented to increase this participation among Filipino Americans in the All of Us research program?
Well, as my students would say, we need to know about social media. And I believe partnering with Filipino American social media influencers with a significant community following can help raise awareness about the program. You know, hosting community events such as health fairs or town hall meetings can provide an opportunity to engage with Filipino Americans and address concerns and barriers to participation. So incentives, and I've seen this, people like gift cards, anything that's health-related items, healthcare services directly to the community, making it more convenient for individuals to participate in medical research. Finally, also again, materials in Tagalog. And I think that's really important, that we need to let our Filipino American participants be able to read what are their concerns in their language so that they can make a very important informed consent, and also will help them understand some of the ways to access healthcare.
Those are all great strategies. Thank you for sharing your expertise with us today, Dr. Abriam-Yago.
Well, thank you for having me here.
Thank you too to all our listeners for tuning in to our podcast on the low percentage of Filipino American participants in the All of Us research program. Remember, increased participation can lead to more accurate and comprehensive health data specific to our population, which can help improve healthcare outcomes and reduce health disparities. Thank you.